Hello, hello. Good evening. Hello, everybody coming in. Welcome, welcome. Great to be here with you. I am Shaya Hecht, psychotherapist based out of Brooklyn and Queens, New York. So welcome. Tonight, we're going to be talking about secondary trauma and the impact of secondary trauma. We'll try to define it a little bit and paint a picture for what it looks like and maybe why things happen that way, and then answer some of the questions that have been previously submitted. Just wait a couple seconds for a few more people to join. I'm really happy we're doing this together. Okay. So secondary traumatic stress. So normally when we think of trauma, like if probably before this whole ordeal began, we would imagine trauma to be, or someone who's traumatized to be, a firefighter going through a fire, or some type of accident and a catastrophe, or something like that. Rarely do we think about trauma as a regular person, maybe someone like a therapist who sits with people and hears their stories, and that they too can really struggle with significant distress from hearing those stories. So, but that is an actual reality. And actually, us therapists are really at risk on a regular basis when we're hearing stories, because we can suffer from vicarious trauma and secondary traumatic stress. And if we're not taking care of ourselves, it could be very challenging for us and for our clients. So in a similar way, when people are hearing stories or watching clips or images or videos or things like that, and they're witnessing someone else's distress, it has a tremendous impact on the system. And really the symptoms that they can have are very similar to the symptoms of someone who is suffering from post-traumatic stress disorder. So there can be hyperarousal, there could be distressing emotions, there could even be dissociation, and many other types of symptoms that will impair their ability to function in their normal way. Images can be hard to get out of their head, re-experiencing them, reimagining those images and stuff like that. So there's actually researchers who research secondary traumatic stress, and they found that people who are helpers, right, are suffering from the same things, sleep disturbance, and probably things that many of us, if not all of us, have experienced just from witnessing and hearing the stories and hearing the news and watching certain things. And as much as we try, some of us, to get it out of our consciousness or to set up boundaries around it, unfortunately, things penetrate, we hear things, and we're witnessing on a regular basis these days these type of things. And therefore, if we're feeling irritable, if we're having a hard time sleeping, if we can't get images out of our head, if we're having distressive emotions, then that is something that is very, very real. And you should know that it's something that's so expected to happen during this time, and you are going through traumatic distress. And in very severe cases, it could be even full-blown post-traumatic stress disorder diagnosis. So, for people, let's say a helper, or those of us who we really need to help people in our family, or we want to do something for Israel. So there's oftentimes, like, what we need to have is empathy, and we do have empathy. And empathy is a way of feeling along with people, which is what we're all experiencing, and that's beautiful and a wonderful thing. However, there's such a thing as empathic distress, where we're feeling so much alongside people that the part of our brain that actually feels our own pain gets activated, and we're actually feeling our own pain alongside their pain, which could become very overwhelming and difficult, and also not be able to help the other person if we're so focused on our own pain. So that's where it would show up, like, let's say with a helper. But even with people who are watching these videos and things like that, if we're having a lot of empathy and we're constantly feeling alongside those people, then we could actually also get fatigue and really be suffering and struggling as well. So what would help is to be able to not only feel the empathy, because that's, let's call it negative, if there's too much of that, but we want to be able to move it into compassion. So we need empathy, but we also want to have compassion where, in addition to the feelings that we're having, we want to be able to do something for the other person that's struggling. So that way we're not getting fatigued and we're not only feeling our own pain, we're actually also helping the other person. So as we're witnessing, there's so many things that people are doing for others. So I would definitely recommend that if you're feeling the empathy and you're feeling alongside those who are struggling, it's really, really important to be able to try to do an action or something that will help the other part of your brain that's much more positive and definitely has more tolerance to be able to cope with that in a much easier way so that you don't necessarily struggle as much with the traumatic symptoms. Okay, so we covered traumatic distress, we covered empathy and compassion. There's such a thing as, let's talk about happiness in general, because I think that will help us cope at this time. What is happiness? So people have studied this, and the researchers show that happiness is whole being. So we have to be able to be a whole being, which means we have to be able to feel all of our emotions. So if we're in distress and we're not going to be able to feel and live as a whole person, then we are going to be really burnt out and fatigued, and we're not going to be functioning well. But they found that if we focus on five layers of functioning, or 5 layers of ourselves, and we're making sure that we're in check in all those things, then we're going to be able to really be okay and be resilient. So the acronym that they give is SPIRE, S-P-I-R-E. So the S stands for spiritual. We have to be able to be nurturing ourselves spiritually at this time, and whatever that means for you, whether it's spending time in nature, whether it's prayer, whatever that might mean for you, we have to be able to experience that dimension. The P is for physical. We have to make sure that we're getting adequate rest and exercising. So if we're feeling too much empathy and we're watching all this stuff and it's causing us to not get adequate rest, we're not going to be able to access that resilience, right? So we have to make sure that we're taking care of ourselves in a way where we can sleep and exercise. And if anyone's having trouble sleeping, again, that makes a lot of sense. And there are things that we could do to help ourselves to do better in that area. I don't know if we'll cover that tonight, but we could definitely do things. The I stands for intellectual. So you want to be making sure that you're working that part of your brain where you're learning, where you're satisfying your curiosity. R stands for relational, our relationships. So we have to be able to be relational. We have to be surrounded by people who care about us and people that we care about, and we have to be connecting to them. So if we're so overwhelmed that we're having difficulty connecting, we want to make sure that we're able to get grounded and regulate ourselves so that we can connect to other people, because that's also going to help us get through that. And the E is emotional, that we have to be able to feel our emotions. So if we're only getting overwhelmed and we're having difficulty feeling the full gamut of our emotions, that's going to be challenging. So we want to be able to feel our emotions in a way where we're not so overwhelmed, so that we can be resilient and have a more positive experience. So something that's suggested for like a behavioral types of things to do for resilience is to focus on 4 components. And those are getting adequate sleep, getting good nutrition, regular physical activity, and active relaxation like yoga, meditation, relaxation exercises. So if these are things that you don't normally do, I highly encourage to really try to learn how to do this. And if it's something you do normally do, but you're feeling like this is not something that I can do at this time, the world is so scary right now, there's so much big stuff going on, how can I do these mundane things? It's essential that people do these things. I can't stress it enough, so I'll just repeat them again. The 4 things are getting adequate sleep, good nutrition, regular physical activity, and active relaxation. In addition, it's really helpful to be getting support from others, to tap into your support system and get support from other people. Okay, and then on a cognitive and spiritual level, you might need some time alone to think, to reflect, to practice grounding exercises. You want to challenge any types of internal dialogue that's negative, and you might want to spend time in nature. That's very, very helpful as well. And on the emotional side, so what sometimes is recommended is something that's like a very overwhelming experience to be able to get those emotions out. So whether that means to journal, whether that means to do some type of ritual, which I don't know if I want to spell out here right now, but there's certain rituals that we can do to make those emotions fly away, so to speak, and get those out of our system. And also we could practice self-compassion. And I want to stress, because it's such a hard time right now, the research on post-traumatic growth. So even though we can be struggling with secondary trauma and we can be struggling with trauma directly, it's really hopeful to know that so many people have been through trauma, have been able to get through it, and they've had actually post-traumatic growth where they've been transformed in so many levels, whether it's in their interpersonal relationships, whether it's a greater appreciation for life, whether it's new opportunities, whether it's a greater sense of personal strength or spiritual changes or development. These are all things that people have been through trauma report, and we will be able to grow from this experience. I hope that covered the topic of secondary trauma, vicarious trauma, and what it might look like and what we could do for ourselves. And if no questions are coming up here, I'm going to just go over some of the questions that have been submitted and do my best to answer them. So question number 1 was, can you be traumatized from seeing images and videos? So yes, in fact, research has shown, like the research on 9/11 and other types of massacres has shown that even that people who watched the videos were even sometimes more traumatized than the people who have been through those experiences. So absolutely, images and videos can be traumatizing. It creates a psychic wound in your brain, and you can have real significant distress from that experience. So I know, like, my colleagues are begging people to not watch videos. It's really, really essential that nobody watches videos. I think I'm back. Okay. Now, someone's asking, what do I do if I feel like I can't unsee disturbing content? Could someone just give me a thumbs up if I'm still alive here? Okay, if you could still hear me, could you just let me know? Oh, amazing, thank you, I'm sorry. Okay, so somebody's asking, what do I do if I feel like I can't unsee disturbing content? So, like, as we said, the images are intrusive. They are intrusive, and they are overwhelming. So, unfortunately, they're right that you can't unsee intrusive content. However, there is an ability to reduce overwhelm. Okay, so even though there's an intrusive memory or image that's going on, if it's really, really getting in your way of functioning, there is a way to be able to separate from the overwhelm of that experience. One thing you could try to do is some meditation to try to relax yourself and ground yourself. And what helps for me sometimes is to be able to, like, welcome in this image, even though I know, like, we want to do the opposite naturally, is to, like, shut it out, but then it's going to come back and create more anxiety. So something that's helpful to me is to be able to, like, let myself know that this makes sense, that I'm really scared about this, and it makes sense that this was an overwhelming experience, while I'm grounding myself. And as I do that and I welcome it in, but I'm also reminding myself that in this moment, I'm very safe. In this moment, I feel my feet on the floor, I feel my body's in my chair, I am safe. It's an intrusive image that's scary, and it makes sense that it's overwhelming my system, but right now I'm really safe. So hopefully that could be helpful. Maybe one day if we have more time to elaborate on that. Someone asked, what's the difference between primary and secondary trauma, and are the treatments different? So hopefully now you got the answer, but primary trauma is a direct experience or a number of experiences that somebody's experiencing. And the secondary trauma is an indirect experience where you're hearing someone's story, or you're witnessing somebody go through something, or you're watching something. And again, so regarding the treatment, are the treatments different? So if it's full-blown post-traumatic stress disorder, which can happen even if it's secondary trauma, then the treatment is the same that you would have for a primary post-traumatic stress disorder, right? The treatment will be the same. But if it's secondary trauma, that's not full-blown post-traumatic stress disorder, but it is causing distress and affecting your functioning. So go back to the things that I mentioned before in order to get back to yourself and ground yourself so that you're able to function in a much better way. Okay, yeah, so just like a brief review on that is to focus on your self-care, You might want to journal, you might want to join a support group, ask for help and reach out for help if you need. How can I address my lack of appetite and ensure I'll still get proper nutrition? Okay, so it's actually really fascinating the way that our bodies prepare us for distressing experiences. So part of why we lose our appetite is because our body's preparing for us to survive a threatening situation. So if we had food in our systems, we would get slowed down by needing to relieve ourselves, or our bodies could be reacting to the food. So our bodies are actually preparing by making you lose your appetite so you don't eat, because your body thinks that things are very unsafe right now, and that makes a lot of sense, like we said. So it's really essential that we teach our body that we are safe. And the way we do that is by putting food in our mouth, even if we have no appetite. It's really, really important. I know it feels disgusting and you're nauseous or whatever, but like if you put a cracker in your mouth, a pretzel, something, right, so that your body sees that like you're taking control, that you're grounded, that you're okay, even if you don't feel okay, that way it could really get back to itself. You asked about proper nutrition. I don't know that I would like so focus on the nutritional aspect of it right now, especially when it's like so stressful, but definitely we want it to see that it's eating something so that we get more grounded. Okay, the last question that I received was something about, is it possible to prevent my trauma from impacting my child? I don't know if it was specific to this trauma that people are going through, but of course our children might get impacted by our experiences. And that's okay, that's expected, that's very, very normal, and that's not necessarily gonna mess up our kids. The challenge is when we have experienced trauma and we're not getting help for ourselves. So now we're parenting out of a distress lens, right? And we're parenting out of our own distress, which could be harmful to children. So what we would want to do in those situations, if we're really not doing well, is to really reach out for support so that we can be grounded and we could be clear, we could be in our self and not in our overwhelmed self, so that we can parent our kids effectively. And that's absolutely possible. Many people have been able to do that. So I'll wait another second if anybody else has any questions. I feel like we covered a lot. But let's see what people say. I believe next Thursday I'll be back on OKclarity's account to talk about survivor's guilt. But today, let's do a quick review. Covered secondary trauma. We covered what to do, because it is very real. It's a very real experience. I beg everybody to please stop watching videos. It creates a real wound. So please, there's no need. You can get plenty of news without having to watch a video. Also, remember about the self-care and the SPIRE acronym, which was the spiritual, the physical, the intellectual, the relational, and the emotional. We have to be able to ground ourselves in all of those areas, because that's going to help us feel the fullness of our emotions, which is going to help us be resilient so that we can get through this. Okay, hopefully that answered it. And it was great to see everybody. And I remember, connection is so soothing to the nervous system. So connect with people you love. It's very, very, very important. And if I could just end with pleading with people to not share news with anybody, because you never know who you're triggering. So even if like it's so innocent and you're in the street and you say, oh, did you hear what happened? Or did you hear the kids' schools are having extras, whatever. I don't want to say words that might trigger people here. I'm dealing with people for the last week and a half that are literally getting traumatized just from hearing these words. So as we know, since secondary trauma is real, only share with people you know are part of your support system, or people who you've been sharing with and they're okay and you know they're okay. But to just open up a conversation with other people, it really just is really not, you might be really hurting someone unintentionally. It's very innocent, but really I would definitely recommend not doing that. Okay, it's been a pleasure. Great to see everyone. Have a wonderful night.